A very good evening to all of you. Today we are going to do the Neet PG MCQ challenge, ophthalmology. Why this subject is important is we all know that some major chunk of questions, major chunk of questions appear from ophthalmology in INACT, sometimes up to 18 to 16 to 18 questions in INACT. And in Neet PG, at least 10 to 12 questions appear from ophthalmology. And if you master those important topics like cataract, glaucoma, retina, some image based questions, you will be able to score full marks in this subject. And your rank will go into 3 digit, 2 digit ranks, or even single digit rank. So please study this subject. So let's begin with the first question. Transducin is a protein found in A. Glomerulus, B. Retina, C. Skeletal muscle, D. Adrenal medulla. Well, the correct answer here is retina. Transducin is a heterotrimeric G protein. It is also called GT, that is naturally expressed in vertebrate retina rods and cones. Mechanism of action is heterotrimeric transducin is activated by conformational change in rhodopsin due to absorption of photon by rhodopsin active group retinal. Activation causes the GDP bound to alpha subunit to be exchanged with GTP from solution and results in activated alpha dissociating from beta gamma. Active translucin alpha then causes cyclic GMP phosphodiesterase to increase its activity, thereby lowering the concentration of cGMP, which is an intracellular second messenger molecule. Decrease in cGMP concentration leads to closure of cGMP regulated Na plus and Ca2 plus ion channel. If you don't understand, just rewind this video and see it again. Listen carefully, then you will understand it. A hyperpolarized membrane potential. This chain of signaling events is called vertebrate phototransducin cascade. So it all happens in the retina as shown in the image. So the correct answer here is B, retina. Let's move to the next question. Treatment of Moran's ulcer is A. Corneal graft, B. Immunosuppressive, C. Topical steroid, D. All of them. Before answering this question, let us know important points regarding Moran's ulcer. Moran's ulcer is a severe inflammatory peripheral ulcerative keratitis. It is also called chronic serpiginous or rodent ulcer. The treatment is topical corticosteroid, immunosuppression with systemic steroids, that is cyclosporine, soft contact lens, lamellar or full thickness corneal grafting. Moran's ulcer is a rare idiopathic ocular disorder that may lead to blindness due to progressive destruction of the peripheral cornea. Although the etiology of Moran's ulcer is poorly understood, recent evidence suggests that the pathogenesis of this disease appears to be a result of an autoimmune process directed against the molecules expressed in the corneal stroma. Moran's ulcer is also defined as a special and the most common type of peripheral ulcerative keratitis. The signs and symptoms of Moran's ulcer can include pain in the affected eyes, redness of affected eyes, progressive ulceration of cornea, blurred vision, photophobia, tearing. So the correct answer here is D, all of them. Which of the following condition is associated with development of posterior staphylomas? A. Pathological myopia, B. Retinoblastoma, C. Acid injury, D. Sympathetic ophthalmia. So the correct answer here is pathological myopia. Posterior staphylomas, that is posterior outpoaching of the wall of eye, is an important component of the diagnosis of pathological myopia. It is one of the hallmarks of pathologic myopia. With the exception of inferior staphyloма related to tilted disc syndrome, it does not occur in pathologies other than the pathologic myopia. The presence of staphyloma is specific of pathological myopia. So the correct answer here is A, pathologic myopia. Fundus fluorescence angiography of a patient done in a patient following cataract surgery shows a flower petal pattern. What is the most what is he most likely suffering from? A. Macular hole, B. Cystoid macular edema, C. Central serous retinopathy, and D. None of the above. See, here he is showing features of cystoid macular edema. Cystoid macular edema refers to a condition in which there is fluid accumulation in a honeycomb-like spaces of the outer plexiform and inner nuclear layers. Fluorescence angiography done shows leakage of fluorescent dye from the perifoveal retinal capillaries and peripapillary region and accumulating in a flower pattern around the fovea. It occurs most frequently following cataract surgery, especially if the surgery was complicated or prolonged. So the correct answer here is B, cystoid macular edema. Kayser-Fletcher ring is found in which layer of cornea? A. Bowman's capsule, B. Substantia propria, C. Descemet membrane, D. Endothelium. So the correct answer here is C. Descemet membrane. Placido disc is used for diagnosing which of the following condition? A. Uveitis, B. Keratoconus, C. Retinoblastoma, D. Retinodesma. D is keratoconus. Laser used to manage after cataract is A. Excimer laser, B. argon laser, C. Diode laser, D. Nd:YAG laser. It is Nd:YAG laser. Macular sparing is associated with lesions of A. Optic nerve, B. Lateral geniculate body, C. Occipital cortex, D. Optic chiasm. It is occipital cortex. Satellite nodules are seen in A. Fungal corneal ulcer, B. Tuberculosis, C. Sarcoidosis, D. Viral ulcer. It is fungal corneal ulcer. Herpetic keratitis is treated by A. Analgesic, B. Atropine, C. Steroid, D. Idoxuridine. It is idoxuridine. An elderly male with heart disease presents with sudden loss of vision in one eye. Examination reveals cherry red spot. It is correct diagnosis is central retinal artery occlusion. It is characterized by sudden painless loss of vision, cherry red spot, and cattle tract appearance of retinal vein. So the correct answer is central retinal artery occlusion. B. Go to the description. There a link is there. Click the link and you will join the ultimate Neet PG breakthrough blueprint covering all the 19 subjects in the holistic manner. Osseous ring occurs in A. Lens dislocation, B. Concussion injury, penetrating injury, extracapsular. It occurs in concussion injury. Mucin layer tear film deficiency occurs in A. Keratoconjunctivitis sicca, B. Lacrimal gland removal, C. Canalicular block, D. Herpetic keratitis. It is keratoconjunctivitis sicca. We all know about this condition. This condition is repeatedly asked in the examination, keratoconjunctivitis sicca. It is chronic inflammation, immune complex deposition, and primarily the development of secondary jaw growth syndrome. Soft contact lenses are made up of very important question. A. Polymethyl methacrylate, B. Hydroxymethyl methacrylate, C. Glass, D. Silicone. It is hydroxymethyl methacrylate. Golden horse syndrome is associated with which prominent ocular manifestation? Microcornea, megalocornea, sclerocornea, epibulbar dermoids. It is epibulbar dermoids. Golden horse syndrome, oculo-auricular vertebral dysplasia with hemifacial microsomia, is a rare congenital developmental anomaly involving the first and second branchial arch. The classical features of this syndrome include ocular changes such as microphthalmia, epibulbar dermoids, lipodermoids, and coloboma. Oral features such as preauricular trachea, hearing loss, and microtia. Type of collagen present in cornea is it is type 1 collagen. Ilching pear are a sign of A. Chronic uveitis, B. Secondary cataract, cystoid macular edema, secondary cataract. Rosette cataract is due to trauma. Eales disease is recurrent periphlebitis retina. The earliest change noticed in hypertensive retinopathy is arterial swelling. Darlip sign of ocular grave disease refers to and retraction of upper lid. Best method of detection of retained glass intraocular foreign body is CT scan. Isolated painful third nerve palsy is a feature of aneurysm of ophthalmic artery. All of the following are true of sympathetic ophthalmitis, except affects the injured eye. Diabetic cataract is due to accumulation of sorbitol. Please share this video with your friends, near and dear ones, so that all of them are benefited. Please share this video with every MBBS student who is aspiring for a good rank in NEET PG, and please subscribe so that you get the notification. Wishing you all the best.